I've been seeing Dennis and his wife for about 13 years. He's an adult diabetic, hypertensive, so I do see him usually about twice a year. But when I saw him at the end of July, he had been seen twice at the walk-in clinic. I saw him, I think about 6 days after his first visit. And it was pretty apparent to me when I saw him that there was something significant going on with him.
Well, it's kind of like Superman with kryptonite. It just drained my whole body. I didn't have any energy. I just didn't have any strength. I was running a high fever, real strong headache. Couldn't get rid of it.
I talked to him about the possibility of going to the hospital. I said that was my recommendation, and I don't think was real happy with that.
Dr. Miller recommended that I go into the hospital. In fact, it was more than a recommendation. He says, "You're going to the hospital."
From that point, I called the admitting hospitalist, and Dennis was able to go from our office here on the west side directly to a hospital bed at St. Luke's without any further stops or hassles in between.
I can tell you they processed me really quick in the admissions and got me up to a room. Right away they put me on fluids and that, and we're doing blood work and that to see what I had. Basically,
he had a strep infection. You know, it wasn't obviously apparent to everybody that this is, oh, quote, this is strep, you know, you get some penicillin and be fine. He really had a very elaborate infectious disease workup, including spinal tap and other imaging studies. But I think once the problem was truly identified and treated appropriately, he certainly began to get better.
I tell you, I had the most respect because I'm a shift worker, and the RNs, the nurses there are also, most of them are shift workers, and I just have a lot of respect for them. I mean, every time I push the call button when the IV was in me and the pump was getting air in the system and that, they would come running right away and clear it. So, and you got to know them personally. My wife would come and visit, and co-workers would come, and you got to talk to the nurses, and they're just people like we are. I guess the process of recovering is actually harder than the process of getting sick. We feel like we need to get right back to where we were, and we got to actually take it step by step and let ourselves recover.
In Dennis's case, that to me is one of the most rewarding things as being a physician. You can see a patient who you've been taking care of for 13 years, and you got to know him very well, and you got to know his wife, and you know a lot about him. And he comes in, and he is obviously something's going on, and he's sick. And to be able to get him directly admitted to St. Luke's, promptly taken care of, treated, identified, and come back improved and on the road to recovery, it's very satisfying. It's a very satisfying part of the work, part of our job.